And welcome back to The Factor Uncensored. The U.S. has been experiencing an Adderall shortage for 7 months now. The medicine is critical to treating people with ADHD. Millions of Americans are living with the disorder. My next guest explains why it's been hard to keep a steady supply of Adderall for those who need it.
We have with us Nushin Rugari, who is a patient, and you have used Adderall. Tell me, how important is it for you, and what shortages have you experienced in going to your pharmacist and your doctor?
Actually, I'm kind of in the phase of like coming off of it for that factor. So it gives me a reason to not be so much dependent on it. But I would say I probably have been on it since college days. And I think I see the effect of a lot of people probably realizing now that you can't get it, how drained you are, how much you're not able to focus. And so you're having to kind of deal with that, which before you could, probably get it at any time, take it when you needed it. And for me, I feel like as an adult, I'm more drained. I'm not able to focus on my daily task. And I think it's affecting a lot of people, especially more so people that need it a lot more than I probably do.
And are you hearing from those who may use it also, who need it, that it's difficult to find now in the market?
Yes. I didn't realize, I thought it was maybe just here and there, but I didn't realize how bad it had gotten.
And it has gotten bad in this country. We also have with us Dr. Jeff Pruski, co-founder of Revive and 3R Regenerative Medicine. Dr. Pruski, why are we seeing this shortage? I know, according to news reports, it started back in September, October of last year. What's playing a role in the supply and demand problem?
It's we're getting various sundry information feedback, but I think originally, COVID had a lot to do with this, with the supply chain, not being able to get certain things. And then you start thinking, but why is it just Adderall? Why isn't it other heart medications or other things that people are taking on a daily basis as well? But then if you start looking at the timelines of when this started and also with COVID, a big part of it was the number of people during that two and a half years that began taking Adderall. They went to the physician, whether it be a Zoom meeting with the physician, that the physician said, well, I see that you're experiencing these things, and it's like burnout from COVID. Your whole life is changed. You're staying up all day and all night. Your eating habits aren't what they used to be. People that were working from home rather than from the office. It just really changed their life a lot. And so people were having a very difficult time adjusting to this. So therefore, one of the things that the allopaths did was to reach out and say, okay, we can treat it in this manner. They did. Well, all of a sudden now we have this huge impact of prescriptions for Adderall, prescriptions that are being written for Adderall, and the DEA, it's it's a very controlled substance. It is addictive, and it's what symptoms are when people cease the medication. It can be very difficult, right? I mean, agitation and sleeplessness, and then it's all over the board. Imagine you had some friends that's like, "What's up with you?"
Yeah, and I can't imagine how it is for kids. I mean, for me as an adult, and then with age, you already are going through a change where you're more drained as a woman, and I think with all of that together, you become dependent on the Adderall or something to help you kind of get your natural day going. And so, yeah, with this shortage, I totally think there's a lot of people suffering with that factor.
No, doctor, there was a 30% increase in prescriptions during the pandemic for Adderall. Do you think all those people actually needed it, or they could have found other ways to cope?
Well, from my perspective, I'm sure there were some that really needed that extra boost, but maybe, as she was saying, just for a shorter period of time, not for this longer duration. And going back to the question you asked earlier, the DEA, they control this, and they say, hell, we're only going to produce so much of this. We don't need this Adderall out on the street because it's a medication that is highly sought after on the street, and so and not with prescription. So people, what they were doing was they were finding that there's no supply there, and the DEA is saying, okay, we only want X amount of prescriptions written. There's really a couple big companies, pharmaceutical companies, that produce this. And so when the DEA says you're going to keep it under this level, well, they did keep it under that level. But when you have a 30% increase, as you said, of prescriptions that were written, that becomes a perfect storm. And So the answer to the question on the second question, no, I think there are many, many ways that people are, as this young lady is also doing, finding ways to cope with that, and which is really what we should have been doing in the first place, which is simple things like sleep hygiene, making sure we're able to get a good night's rest. We sleep in the same routine we did before COVID, right? Eating correctly, making sure that you're getting out and getting exercise. And again, there's some other supplements you can take that are natural, like with the company we have with Revive, that's centered around natural botanicals to take the place of prescription medications that are not as harmful, don't have as many side effects, can be very, very beneficial if used correctly.
Don't go anywhere. We will continue this conversation after the break. And welcome back to The Factor Uncensored. We continue our discussion about the Adderall shortage in pharmacies across the country. Now, according to my next guest, people have resorted to looking for alternatives for the drug. However, it can be difficult to make that transition.
And doctor, are there alternatives for kids, for young people who may not be able to get that Adderall that they need in addition to what you are suggesting for adults?
Well, we go back to talking about coping skills. I was speaking to a teacher, a retired teacher, and I was asking her, how did she deal with children with Adderall? Now, this Ritalin and some other ones are prescribed more so for children, and that drug wasn't as hard to get as you did Adderall, but it doesn't have the same effect. And you give it, I don't know if you tried the Ritalin, but it will make you feel very different than what you were able to obtain through the Adderall. There's a couple other that are out there as well. But what this teacher told me, she said, well, you know what I would do? And she taught third grade math. And so, that's hard enough to capture the young children's attention in the first place, much less if these kids are having problems with ADD or ADHD. So what she did is she had other coping skills for these kids. Like, if you need to get up and move around the room, let's go for it. And she had a basket. Literally, she told me, I've got a basket full of widgets. I think she called them, or fidgets, like fidgeting, right? So the kids would come in and they would grab the little exercise ball or do some other things, and so here's your, it's 5 minutes, do your little fidget, and now let's get back to work. And the kids over time learn to condition themselves. It's like, okay, we're going to focus right now. We'll have fun in a minute, but then we're going to focus again in a little while. But she would take intermittent breaks, which is another way of a great coping skill. So yeah, it's difficult. And as you know, it's about a 90-day period. So when we talk about, can we transition to these people? Well, if you start with these, I'll call them more natural approaches. If you start with that, rather than starting with the medication, the prescription medication, it's not near as difficult. And you can see some benefits with it if you're consistent with it. And it's a task for the patient and the parents both. If it's a child or an adult, it's just hard to, your schedule, you're running, it's hard to eat the way you should. And then you go home and you're exhausted. You don't work out the way you should. It's this catch-up game. But the problem is, once you've been on Adderall or Ritalin for for years, a 90-day period is going to seem like an eternity to where you kind of get things straightened out, because it's like anything else. It's an addiction too. The body has to change here.
I think people are finding alternatives, like you said. I've been doing more all natural stuff, and it's been working. Not as good, but it's working, because also people get used to the drug. And it doesn't have the same effect that it did when you first started taking it. So I noticed that. Like you said, this is not something that a lot of kids are on. But I do remember when my son first, they tried to give him Focalin, I think it was. Okay. I tried it myself to make sure, what does he feel like on it? Would it make me feel a certain way that I wouldn't want to see him on it? And I didn't like it.